And we're going to begin with this. A CDC investigation revealing new information about the explosive coronavirus outbreak at several Washington state nursing homes. The probe says it was fueled by missteps, including 6 staff members. 35 fatalities are linked to the Life Care Center in Kirkland. That is the hardest hit facility. And our Jonathan Vigliotti shows us what investigators have found.
Among the key findings, some of Life Care's staff worked while sick and in some cases worked a second shift in other facilities, raising concern that the virus was spread from one nursing home to another. Already in King County, at least 10 nursing homes are reporting cases of the coronavirus.
A newly released CDC report is shedding light on how the coronavirus spread at the Life Care Center in Kirkland, Washington, and other area nursing facilities. The agency says of the roughly 130 residents at Life Care, 62% became infected and 27% have died. We first met Carmen Gray earlier this month.
They're being held hostage in a Petri dish.
Her mother, Susan Haley, is one of the Life Care residents who tested positive.
I'm in shock. This report it's despicable.
According to the report, in mid-February, several residents developed respiratory illnesses but tested negative for influenza. It wasn't until roughly 2 weeks later, February 28th, that health officials confirmed the first case of coronavirus. Timothy Killian is a spokesman for the Life Care Center.
Had we gotten those tests earlier, all of this might have played out differently.
But the CDC says several other factors at the nursing homes also contributed to the spread, including staff members who worked while symptomatic and worked in more than one facility, inadequate supplies including personal protective equipment and hand sanitizer, and limited testing.
Both my sister and I had concerns about the lack of use of hand sanitizer and only having masks on and wearing the same mask in and out of one room to another.
Are there things within the report that are troubling to all of us? Of course. There was questions about proper infection control. This disease, this virus, requires measures different than anything else we dealt with before.
At least 34 Life Care Center employees and 14 visitors also contracted the virus.
I hope that they find this as an example of what not to do. If you listen to the doctors, they're saying that it's going to get much worse before it gets better.
And the CDC report doesn't mention their own shortcoming with delayed testing, nor does it mention the initial response by Washington state health officials, who just 4 days into the outbreak said their resources were stretched thin.
Jonathan, thank you. And our Dr. Tara Narula is back with more on this. We heard one of the relatives say that their family members were held hostage in a Petri dish. It's a terrible situation. What are the lessons here?
Yeah, I mean, it kind of is the perfect storm. These are people that are in very close contact. The median age is 81. We know the death rate goes up if you're over 80. And a lot of them have these chronic medical conditions like hypertension, cardiovascular disease, kidney disease, diabetes. So it's a tough situation, and it really tells us we need to be proactive. And I know we are taking those steps now.
We've seen family members who can't visit their loved ones in nursing homes. It's very painful for them, but it's important for them to stay away.
It is. We know that most of these cases happen from either a visitor or a staff member bringing the infection in there. So it is hard to stay away. It's very difficult, but it's very important.
Yeah, I'm still stuck by that Petri dish reference. Yeah. It's like they were sitting ducks in some way. Can you be exposed to it, Tara, and not get it?
Well, you can be exposed to it and not mount a reaction that somebody could pick up on. So it could be either asymptomatic or mildly symptomatic. So a lot of this is about active screening for fever or respiratory symptoms in staff and patients so that you can act quickly.
And is it important to point out that most people, depending on your age, it's very survivable?
It is.
People need to understand you can survive this.
You can.
Most people do.
Most people do. But again, those vulnerable populations, the elderly, those with chronic medical conditions, are more at risk of having severe complications.
All right, Tara, thank you very much.